going to be really important that we stabilize the ilium, because if the ilium moves and she has a sprain or a strain, we'll stir things up. So I'm going to stabilize the ilium. And then, friend, I want you to gently push your knee into the table for 5 to 10 seconds. Go ahead. And gentle, 10%, maybe 20% of contractions, 6, 7, 8, 9, 10, relax. Now, very important, stabilize the ilium, and then ask friend to slowly lift her knee up and stretch for 1 to 2 seconds. And then from that new resistance barrier, push into my leg one more time. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax, and then lift up and we'll stretch for 1 to 2 seconds. And now I'm going to do what's called active assisted. Go ahead and lift up, hold the stretch 1 to 2 seconds. Friend relaxes, let blood and nutrients get back into the tissue for a couple of seconds. Lift up again, 1001, 1002. Now, if you're a manual therapist, you know that the psoas attaches to the lumbar spine, so don't cause increased pressure. Don't override the stretch end feels. Don't cause pain. And when you're done stretching the iliopsoas, you know that that's going to allow those lumbar spine discs to decompress. In the therapy on the table, we have to assess. When I put my thumbs on the crest of the ilium, what you'll see is that I have a high right ilium. Now, what it is not is it's not anteriorly rotated. It's simply elevated. So typically what that means is that I've got a QL and an erector spinae that are tight on the right. So think about this action. My QL can either laterally flex my lumbar spine, or my QL can, with my gluteus medius, can elevate my ilium. So as my QL fires, if it just pulls from the upper ilium, that's a tight QL on the right. So what I'm seeing with Fran is that her right hip is hiked up. This is the short side. And in essence, the left side is the long side. So the high ilium side is the side I'm going to stretch. And then when we get into self-care, Fran will be strengthening the left weak, inhibited left QL erector spinae. And we'll get into that in the self-care exercises. So here's how I'm going to stretch her right quadratus lumborum. I'm going to have Fran lie on her left side down. We'll just kind of put your shoulder in there. I'm going to bring this leg. Now, one of my pet peeves here, after I flex the bottom knee, I do not want the femur to extend, because when the femur extends, we can cause an anterior and inferior rotation of the ilium, and that could stir up stuff on the back. So to keep her from feeling like she's falling off the table, I get up behind her leg like this. I get distal or proximal to the knee, and then I come up under that 12th rib. Now what you're going to do, and I want to give Fran a kinesthetic cue of how to do this right. Instead of abducting, Fran, what I want you to do is hike your hip up. Good. That's the action of the QL and the erector spinae. So the PNF stretch is I'm going to do that for about 10 seconds. Go ahead and pull. If there was a strain, we wouldn't be doing this stretch, but she doesn't have a strain, so she pulls 6, 7, 8, 9, 10. Relax. Take a deep breath. And then, Fran, as you exhale, bring your knee towards the floor and let's stretch for 2 seconds. Now, from that position, hike your hip up again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax, and then pull down.